want to send my greetings to all who are participating in the Adventist Laymen's Services and Industries Conference in Bratislava between the 28th and 30th November 2019. This which I'm faced with, which I need to do away with. And as you are aware, one person will not be able to do everything, so that is why I'm making this appeal to all friends, wherever they may be. Ladies and gentlemen, I am making a request for support for medical equipment for our newly constructed health facilities in Nyamira County. The facilities are as follows. We have an 80 bed maternity wing with the Doctor's Plaza at the Nyamira River Hospital, which is the structures are about to come to an end, and we need to have this amenity wing for our mothers who will be giving birth. Number two, we are making also an appeal to our well-wishers to help us complete an 8-bed inpatient wing, which is at Nyamusi sub-county. It has gone a long way. We also need equipment for this facility. Another facility is a 40-bed inpatient wing at Gesima sub-county hospital, which would also need some equipment. The fourth one is a 40-bed inpatient wing at Manga sub-county, which has also started, and we would like to have it equipped by our friends. And the next one is a 4-bed inpatient wing with operating theater at Mawawa sub-county hospital. And finally, we have also proposed to put up an hospital at Nyamwetureko, and this one will take care of the people who have eyes problems. All these are massive projects that will need a lot of money to bring into fruition, and surely we may not be able to do everything. We are making desperate, allow me to use the word, desperate appeals to our friends all over the world, those who can assist us a bit to move and meet these requirements for our county. May God.
We had 76, only 76 public health facilities within the county, which were, fairly dilapidated, and in most cases, the supply of essential drugs and commodities was very erratic, because we were relying upon a push system, whereby somebody seated at the central level in Nairobi would decide what rations of drugs get to these local facilities. We embarked on, and they also ill-staffed, they were inadequately staffed. So as a department and as a county government, we embarked on a journey of refurbishing and investing heavily in the health sector. And since the year 2013, continuously and progressively, the county government of Nyamira has been investing 30% of its annual budget towards the Department of Health Services so the people of our county Nyamira can receive the highest attainable standards of quality health services closer to them in a manner that is more responsive to their needs, because we of Nyamira are also required to put our best foot forward and prepare our facilities for the rollout of universal health coverage in the country. Therefore, there is need for us to look within and without ourselves for resource mobilization on the next level of expansion of the facility, so that we can be able to properly equip and properly prepare ourselves so that we can offer adequate, reliable, quality, accessible, and affordable healthcare services for our people. That is why in the county referral hospital right now, we are constructing an 80-bed amenity wing. This 80-bed amenity wing has a doctor's consultation plaza and also a continuous medical education section. I think you saw it in the facility and you can document it as well. This facility will go a long way in decongesting the main hospital wing and enabling us to get more revenue, which we can use to improve services in the general wing. For this facility, we'll need equipment, we'll need hospital furniture such as beds, bedside lockers, wheelchairs, vital signs monitors, and all the laboratory equipment, which we will need to properly equip this facility. Unfortunately, the county government alone cannot be able to fully fund the procurement of these equipment because of the limited budget that we have. Therefore, we are going out to appeal to well-wishers, partners, friends, both within and outside the country, to come in and support. For example, we had a program where we have an ongoing program where we source for used but functional medical equipment from especially countries in the West. And if we get, for example, a hospital that is replacing the medical equipment, we can take those medical equipment in. We send our biomedical engineer to the country of origin so that our biomedical engineer can be trained at source, and then we ship the equipment to our county at our own cost and put them to use. We have done this before. We have received several batches of equipment from Europe and from the United States, and this is the support, the kind of support that we are looking for. It does not have to be monetary, but support in kind through this way, or through donation of used but functional medical equipment. As well, besides the Nyamira County Referral Hospital, as you have already seen, we are putting up a 40-bed inpatient. So there are basic equipment that we need at that level. We need equipment for triage. We need simple equipment like blood pressure monitors. We need equipment like glucometers. We need equipment like hospital furniture, patient trolleys, instrument trolleys. Basically, those equipments that can enable the nurse or the clinical officer seated at the primary healthcare level be able to diagnose, be able to be able to get the early symptoms of disease and manage them at that local level before they escalate to further advanced stages that will need serious curative interventions. So primary health care is a core premise upon which our agenda is being driven, and we also seek support in that. Another avenue that we as a country have explored before, and as I speak also, I'm the secretary of the county executive committee members for health caucus in the country, in the entire 47 counties. We realized that our emergency ambulance referral systems are not up to speed as to be as responsive to the needs of the Kenyan people, to respond to the various emergencies in a timely and reliable manner. And besides increasing our fleet of ambulances from our local resources, we have also been seeking support from other friends, countries, or partners who may have these used ambulance vehicles, because in Kenya we have a policy of zero rating any medical emergency vehicle that is brought in, and we have been exploring these options. Quite a number of counties have benefited from donations of emergency ambulance vehicles from countries in the Western world. If also we could be able to benefit from any friend or partner out there who has used vehicles, used ambulances that they want to replace, but these ambulances can be of use to us, give us a useful lifespan of even 5 years, 10 years, we will be more than willing to accept those.
Since devolution, we have seen some goodies which have come to the county hospital. Number one is we have been able to have more employees. the county government, led by His Excellency John Nyagarama. We have been able to be added for more health workers. Now we have more doctors, we have more consultants, more cadres have been added, which has actually improved health delivery services to the citizens of this county, Nyamira County. On top of that, we have seen more development. We have seen radiology coming up, we have seen renal coming up, the new theaters being built. We have seen oxygen plants coming up. We have one here, which has actually eased the burden which we had previously before we could construct this one. We used to procure oxygen probably from Kisii and sometimes from Nairobi. The challenges of transportation, logistics, oxygen could delay. This could hamper how we treat our patients. And sometimes we used to refer patients because of lack of oxygen. But since now the oxygen plant is around, we are able now to administer oxygen to our patients, and our treatment is up to date. On top of that, we are constructing a new amenity block, 88 block amenity, which will house a state-of-the-art amenity wing for our patients, state-of-the-art casualty, and it's now 90% complete. We hope that by early next year we will have finished everything, equipping it, and our residents of Nyamira will be able to use. So we want to tell the residents of Nyamira that their healthcare is well catered for. We have them in our hearts. We are here to do our level best. Of course, there are challenges here and there, everywhere, but through those challenges, we will be able to make sure that we have the best medical care for our people in Nyamira. And as you have come, you've seen today we are celebrating World Mental Day. It's something that was not celebrated before in Nyamira County because of the stigma. People used to think that if you are mentally challenged or you have mental problems, you're supposed to be locked in your house. People used to think you've been bewitched. But because now we have doctors who have studied, they have gone to school, they have come back, we are able to see more and more people from Nyamira and other counties visiting our clinics to get help, and I'm very sure that you will see them when they're coming. They have gone for the roadshow.
We really wish to thank the national government and the county government for aiding us in giving services in this facility. We also have a CSSD machine, a sterilization machine that has recently been brought to aid our services. We also have lab machines, biochemistry and hematology machine. We also have a backup generator. So this facility, we really appreciate. We have been aided so much in the recent past. Though we also wish to cite that we have a few challenges here and there, like equipment. And we wish to put it out there. If there would be any donors or well wishers who would help us even to acquire this new equipment, so that we can give even more services and better quality services, we would really appreciate. So we have equipment that we are missing, such as blood transfusion machines. Equipment needed for blood transfusion, such as the distiller and We also need that is upcoming. There are new wards that are being constructed on the other side to expand and to improve the services in this facility. So this equipment will primarily be set in that new building. So we also may need more. We also need more of the patient beds and linen and the equipment that is used in the new building. Other challenges are like the staff shortage, and also we also have one one source of water. We depend on rainwater. So we need also we may need also a...
And I can say we have really grown in terms of the infrastructure, in terms of staffing, and of course the county government has played a major role in ensuring that we are growing as a facility. Innovating one of our rooms so that we can have a theatre. We also have an ongoing project. As you have seen, some wards are also being added, and this is because of the growing need. At the moment, we are serving a catchment of 22,000, a population of 22,000 in the... However, we still need some help, and we would like to appeal. As a facility, we have tried to put up as many gutters as we can, so that we can have as much rain collected in our tanks as possible. However, the water is now dependent on the seasons, and when it is not raining, sometimes we do experience some water shortages. So incubators will be of help. At the moment we have only 2, and we all know that incubators are not supposed to be shared because of infection control. So if we can have additional incubators, then we can have a separate newborn unit, which will be able to help our newborns recuperate.